Hi, I'm Judy and this is Mischief, my very gorgeous 19-year-old cat. She's doing really well. She's very engaged in life, is happy to interact with myself and our boys, and she's eating well. Her appetite's great, to the point she wakes me up at 1 or 2 o'clock in the morning for breakfast. No, she's doing really well. Yeah, enjoying life as much as she can at her age. She's 19. She was just 19 about 4 weeks ago. Okay, we had a previous cat, Sammy, and Sammy had infected teeth, and the vet we had there just wanted to keep giving her antibiotics injections because she was old as well. She was 18 and said she wasn't going to be up to surgery, and I was a bit concerned, and I love essential oils, so I wondered if there was something we could do with essential oils. And I remembered going to a talk about essential oils about a year before that, and somebody told me about a vet over at Green Slopes that used essential oils. So I phoned up, and they happened to be having a dental health month, so free dental health checks. So we took Sammy along, and that was the start of an amazing journey. Yeah, with Elaine. Yeah. Mischief wasn't as well as she could have been, but I didn't realise that. Diet-wise, we weren't, doing what was best for her. We were using just the run-of-the-mill processed food that you get at the supermarket. But when I got my animals from the refuge, that was what was recommended to us. So Elaine, just showing me that through diet, giving her rainwater to drink, because with cats and their kidneys and bladder, the tap water's really not good for them. So so even though she's had quite a few challenges in the last 2 years, I actually think in many ways she's probably better. She's brighter in the eyes. Yeah, and loves her food more, and it's probably because it's real food. I myself have had a lot of health challenges, and I found that the conventional way of treatment wasn't really giving me the best outcomes. It was creating other problems for me. I was being treated with something, and then I have side effects from that treatment creating another problem. And I reached the point where I was very sick, and after having a lot of time in hospital, and I just thought there has to be another way. And I just started looking into other options, and then it dawned on me that, oh my goodness, my animals could have holistic treatment too. Yeah, and what Elaine's taught us through our pets, we've also been able to apply to our own life. Yeah, so a lot of the anti-cancer things, for example, for them, are anti-cancer agents for us as well. Well, the first thing she did was give her free dental check. And so that was when she talked to us, about diet to really help Mischief's teeth and get them clean. And then it was about 2 months after that, my son noticed that one of her nipples was really red and raised. So we took her in, it was a Monday morning, and she said to me she's got a memory tumour. And I think I went very pale because we just lost Sammy with mouth cancer. That was the cat we originally went with, and Elaine found that she had cancer all through her jaw, and then Elaine sort of gave me a lot of TLC, and then gave me some herbs, sheep sorrel herbs, and she said, I want you to take these home, and I think they were 3 times a day, and come back Friday morning, but we may still need to operate. So we did that, and my kids were pretty excited. Late on the Thursday, they said, Mum, it's not red anymore. It's that red bit, it's shrunk. So we had some hope in our hearts. So we went back on the Friday morning, and when she examined us, she said, that's shrunk 20%. And I was just in awe, of the simplicity of herbs managing to do that. She still needed the surgery, but it wasn't as big a tumour to be cut out. And she has maintained those herbs ever since, I guess because of the age, her poor diet in the past, and the fact that this tumour could have already had little other bits, secondaries possibly, that have gone away. So she was kept on a maintenance dose after that, but she healed up beautifully. Oh, just she's different, you know. It's sort of, you know, just when she's we call it smoochy. You know, she gets all, you know, cats can be smoochy, and she always was, but she can get really, really smoochy and just loves to, you know, cuddle in, and I just think she feels, you know, better in herself. And like, since we've been with Elaine, my son, who tends to, you know, be the party that gets injured the most, he had a really nasty concussion at the beginning of the year, and she just, you know, I could just tell she was comfortable enough to just climb up on the bed beside him and guard him for the night. And yeah, she just seems better in herself. What my children can learn from this, because when she had her kidney disease found, Elaine sat down with my boys, which was part of Elaine going above and beyond, and she explained to them, they were 10 at the time, and she said to them that it was very serious. The you know, kidney test results from her blood were pretty bad, and she said, you may have her 3 months. Well, that was 12 months ago. And so I just appreciate the life lessons they can have, learning the importance of diet, the simplicity of herbs, essential oils, and just looking at other options. And you know, just not having tunnel vision, be willing to have an open mind and look at what else can be done. And acupuncture, yes, acupuncture. How can I forget the acupuncture? Acupuncture. Mischief has had acupuncture, and it has helped her mobility. I have definitely noticed, she still doesn't run around like she used to, but I've noticed when she does jump up onto things, there's an ease there that she sort of flows more than she used to. Yeah, so definitely the acupuncture. Elaine, I can't thank you enough for what you've done for our family. You've just supported us and our pets when we lost our other animals. The way you stepped up and you were, you know, giving us the TLC, that's just above and beyond, you know. And you include my children, they ask questions and you answer them, and that is really important to me. I want them to be able to learn, but to know that, you know, this cat here has had 3 diagnoses that weren't good. They were pretty bad, and here she is, she's still here, and she's interacting with us, and you know, we're enjoying life with her, and we wouldn't have that without you being able to make up, you know, and try to repay what you've done through your kindness, your generosity of spirit, your sharing of your wealth of knowledge. It's been very, very special, and I feel very privileged, you know, that you've been, you know, a part of our family and the journey we've been on. And I'm going to cry. I'm sorry. Because it just means a lot to me. It really does, you know, to have, you know, with our dog, to have previous vets writing her off, and to have another 2 years with her. That's, you know, that's very special. I think have an open mind. I think for all of us, you know, with the traditional veterinary care model, what we've been exposed to and what has been advertised to us, you know, through the television and just all of the media, when you go to Elaine, it's different. She really just has the best interests of your pet at heart, and I think it's important to, you know, go in with that, you know, outlook, and realise that whatever she's telling you, even if she's saying to you, right, I want you to stop going down this road and, you know, consider moving over here. And what I did, I just wrote out all the different, you know, herbs, you know, and when they had to be, and I just had the sheet there, and I would just make sure I was going through it. And now I don't have to, because it's become a routine. But stick at it, you know, don't do it for a day or 2, don't do it for a week or 2, give it a good couple of months, but you will see, you know, progress by then, without a doubt.